May is Skin Cancer Awareness Month, and according to the Skin Cancer Foundation, more than 5 million cases are diagnosed in the U.S. each year. We'd like to introduce Dr. Mirwat Sami. She's joining us out of Houston to shine a light on the disease and help us prevent it this morning as best that we can. Good morning, Dr. Sami.
Good morning. Thank you so much for having me on here.
Well, we're learning as well that you seem to see cases going up. Talk about who is being impacted and why you believe those numbers are rising.
Yeah, so I'm an oculoplastic surgeon, which means I'm a plastic surgeon of the face and most specifically the eyes. And what is staggering is the statistics, the incidence of skin cancer in the eyelid area and in the face. And we're seeing an increase in that incidence, not only in our Caucasian patients, but across the board, even in our Hispanic and Latino population. Something that most people don't realize is that 5 to 10% of all skin cancers can occur in this area right here. That's a staggering statistic. And I see so many patients every week that when we remove the skin cancer, it can leave a pretty disfiguring defect or hole, having to reconstruct that, getting that functionality back to the eyelid, protecting the vision. That's my job. But I will say it gets more difficult the more advanced the disease is, right? So prevention, as we say, is always so much better than cure. And we're hoping with interviews like this and putting this message out there that we are able to raise the awareness of skin cancer, not only in our Caucasian population, but even in our Hispanic, our Latino, our African American population as well.
And Dr. Sami, when you say around your eyes, that's pretty scary because a lot of us think, oh, I put sunscreen on my arms and put it on your face, but you have to be very specific on how you do cover yourself, correct?
That is correct. I think there are some misconceptions about sun exposure and UV protection. People think if it is cloudy outside, they do not need to wear any protection at all, when in fact UV radiation is at its peak in the middle of the day, regardless of your cloud cover. So UV protection is very important. It doesn't matter how cloudy it is. The other reason why we think skin cancer is so high in these, considering the small surface area, it's probably because this is the last place that we can apply sunscreen, number one. Number two, a lot of people won't wear sun protection with sunglasses, or they'll get a really fancy pair, but if you look closely, that might not have any UV filters in it. So always, trying to wear sunscreen. We're seeing that generation that used to slather on olive oil and iodine and just bake in the sun, and the skin cancer rates are so high. But we're hoping that as time goes by, our future generations, because of the education we provide them and this change in our mindset, we would love to see that incidence going down, because even as we speak, in the last 2 decades alone, the incidence of melanoma in Hispanics has gone up by 20%. That is huge, because they always present with a much more advanced disease, thicker tumors, more regional spread, distant metastases. So the burden of illness becomes a lot more advanced, and we would love to keep a check on that. So that's why we have Skin Cancer Awareness Month.
And Dr. Sami, we have about 30 seconds left, but I want to ask you, what is the biggest tip that you can share this morning with our viewers?
Sunscreen, sun protection, always be vigilant. Keep an eye out for anything that is a nodule, a lump, or a bump that doesn't heal, even if it's just like a pimple. Go get it checked. There's no harm in being safe than sorry, and getting routine skin checks is really important, and being aware of your family history as well.
All right, Dr. Sami, thanks so much for joining us. And we'll have a link to your website on KINS5.com if people want to learn more. Thank you so much for joining us and sharing that advice with us this morning.
Thank you for having me. Have a good weekend.